Well, it actually started from a need in the community that we saw. It was for patients in the hospital on a ventilator, but didn't need that higher level of care, but still needed skilled care. To qualify for our unit, you must be on a ventilator for 10 hours. That's not to say that you can't wean off it, but to qualify, you have to have 10 hours of ventilation in a 24-hour period. Our team is individualized. It is very unique. We have PT, OT, speech. We also have RT. We also have social services available. Whether it's short-term or long-term, we are glad that we can give them a place that they can call home.
So when I first came, I was in the pulmonary unit, and I was in bed, couldn't do anything or go anywhere for months. Didn't know at first if I would ever move my muscles again from the stroke.
I have COPD, and I got really weak lungs, and I'm a diabetic and everything, so everything just kind of hit me once.
When he first came here, Stan could not breathe on his own. He was on a ventilator. He was totally dependent for the staff to do all of his daily needs.
My first thought was, I'm going to have to live with this the rest of my life. But I realize now they're weaning me off of it.
I couldn't do anything. I couldn't move this hand at all. And they wasn't sure I'd ever get the right side back. And the night that I held an orange and peel it with this hand, I cried.
Between all the therapy and the machines and keeping me going, I finally get the chance to go home, be with my fiance.
They're doing a fabulous job with me. The nurses are all so good, and the aides, I couldn't ask for better care. It's been a good experience.
I felt at ease knowing that they were right outside. Bell would go off and they were in my room.
I feel safe. I feel like if something happens, I got the people right there that could come to me.
I can't tell you how happy it makes me, because I actually feel like now I might be able to get better enough to go home.
We first started off with it's just taking him off during the day. And this is where we are now. Stan breathing on his own without a vent or a trach.
That was scary, because I depended on the breathing equipment so much.
Getting off of the ventilator after being on it for 13 years is amazing. You have to pinch yourself sometimes to realize that I did it with the help of the pulmonary unit.
Can't say more than enough, thanks for the people that are here.
I can't even explain how grateful I am to all the people who have worked with me and helped me to get through this. They go out of their way so much to make sure that I'm getting the care I need and that I'm happy.
When we found out he was going to be moved down the second floor, I told him that I would still come to visit. I will still make sure you're okay, and you can come visit me, and I'll still give you chocolate. So it was bittersweet for both of us.
This new therapy that I'm getting now with the anti-gravity machine just makes things look more positive.
I have another family now, the Ambassador family.
The staff is great. Everybody talks positive. More than I do. I don't give myself enough credit.
I've came a really long way from the help of these people, and this is like my second home, so I'll be back. Just in a better way.
When I was 17, I was diagnosed with limb-girdle muscular dystrophy. I've been in a chair now for just almost 30 years already, and I've lived at the Ambassador for 12. And I've been completely vet dependent for the last 10.
Came to the Ambassador when I was 8. I was hit by a truck, so I'm paralyzed from my neck down. I've been here for 21 years now.
Particular condition is a progressive condition. So it's a progressive weakening of the muscles. So, over time, you adapt as you go.
The respiratory therapists do my breathing treatments. They suction me throughout the day when needed. They're very helpful.
We have people that run really fast. Look out, because they're coming through. That's reassuring. It really is.
They just help me get through the day, do my treatments, and then get me up from my chair and just give my meds and everything, make sure it's cleaned up.
The people here know what they're doing. They do it every day. Relying on someone else to feed you is a challenge. Let me tell you, some of the guys take big bites, and I don't.
It's just a matter of accepting that your life has changed, realizing that you're just gonna need help from now on. It's not the end of the world.
Oh, we meet a lot of nice people. I spend a lot of time outside. You get to know the other residents, the other family members, and you just make a lot of nice acquaintances here.
We have a very good recreation department that has a large amount of things for us to do.
I like anything outside. Like, been going fishing a lot, and we've gone to like Fontenelle Forest and stuff.
Recreation, we have an activity every afternoon, or maybe to go shopping to Walmart, go to the casino for a while, go to the movies every month. It's a nice way to get out.
They are caring, and they make my day better because it gives me somebody to joke around with or to talk to when I need to.
Some people are here short term, but those of us that are long term, it's kind of a family.
The staff's been really friendly and supportive, and they almost seem like a family member.
I couldn't imagine leaving would be difficult because my goal was to go home. And then that day came and I was leaving my family of friends here. Not certain that I was going to do it at home. The day I went home, I cried several miles. But I've been home 5 months. And I'm doing well. I have to come back to the Ambassador once in a while to see my friends.
With the people they have here, the training they get, the equipment they have, I wouldn't want to go to any other place than the Ambassador. Thank you from the bottom of my heart for saving my life. Thank you again.